Hello everyone, my name is Clarissa Castillo. I'm one of the DMSC students here at AT Still. My presentation today will be catered for colleagues and the topic is on medical remediation. This has been completed for my DMSC 8130 assessment course. I have created a pretest that we can all review prior to the presentation. The first question of the test is going to be true-false. The definition of medical remediation is the act of facilitating a correction for trainees who started out on the journey toward becoming a physician but have moved off course. I want everybody just to think about these questions as we go through the presentation today, and we'll review them at the end. Number 2, the following are benefits of a remediation program. Mark all that apply. Retention of students. B, students dropping out of program. C, improved mental health and confidence. D, educated and competent clinicians. Number 3, the following are challenges of a remediation program. Mark all that apply. Additional expense. B, additional training and new staff. C, large number of students needing remediation. D, limited number of dedicated staff. Number 4, true-false. There are many different frameworks for remediation programs to select from. Number 5, true-false. Most PA programs have a remediation program included in their PA education curriculum. Number 6, true-false. There are 5 areas of clinical deficiencies that are used for remediation at the University of Pennsylvania. We're going to go over that so everybody will know the answer to that when we're done with the presentation. Number 7, true-false. A successful remediation program will not be able to identify early signs of a failing student and address it to help them succeed. Introduction. I've got a short introduction for everyone so that we could understand what we're talking about exactly. The physician assistant programs continue to grow in number. There's over 20 additional programs in the last year that are waiting for accreditation. For a PA program to be successful and to maintain accreditation, there is a direct correlation with student performance and recruitment. The academic remediation is a problem in all advanced medical programs. According to Lane et al., 10% of medical students will experience an academic failure at some point in their training. Most schools offer some form of remediation. There is a reform effort underway in many parts of the world, including the United States, but there are no standardized guidelines yet for the PA schools to follow. Historically, remediation has been considered an individual problem. It's not the whole class, it's not the professors, it's that 1 or 2 students that are unable to pass the courses. An article by Cleland et al. States that remediation should be a part of the structure of medical education with shared responsibilities. They're saying that it should be built into the curriculum, throughout the curriculum, and not considered at the end, when sometimes it is too late. In reality, they stated that it should not be an afterthought. This is something that needs to be identified as soon as possible, so that the solution can be started as soon as possible. The Accreditation Review Commission on Education for the Physician Assistants, the ARC-PA, has not proposed a standard for a process of remediation for PA schools to follow. Research has attempted to understand why students fail. Many have recognized the negative connotation of remediation must be changed. It must be presented as part of medical education and should focus on assessing the learner's challenges and then creating strategies and remedies. In terms of learners' challenges, That could be from social issues, personal issues, substance abuse issues, the lack of adequate housing or food, multiple different issues. But that has to be identified early on so that the solution can be found. Remediation has been defined as the act of facilitating a correction for trainees who started out on the journey toward becoming a physician but have moved off course. It can be applied to nurse practitioners, to PA students, to any medical program. As educators, we have a responsibility to society. We are responsible for preparing clinicians who are competent and will practice medicine safely. I came up with some instructional objectives that will be covered. I think we talked about a few of them briefly already. I would like to, one of the objectives would be to introduce the definition of remediation in medical education, to discuss the benefits and challenges of a remediation program, to introduce a basic framework for remediation in medical education that can be expanded to fit our educational institution, to review the basic steps of remediation, to introduce the areas of clinical deficiency in students requiring remediation, to discuss the results of remediation. There are a few main points that I would like to go over. Remediation is a necessity at this high level of medical education. Our students have worked hard, put in numerous years to get to where they're at. The old way is not the best way. A structured remediation program needs to be created. It's got to be identified early on when the student is starting to have issues so that it can be addressed much more sooner than later to have success at the end. Remediation needs to be included in the curriculum. A programmatic approach must be adopted. Clear steps in the remediation process need to be defined. Framework for collecting data, interviewing, evaluating the information, and then formulating a plan of action. The negative stigma of remediation needs to be changed. Our institution can make these changes. Little by little, we will need additional resources and interested staff who are willing to be trained. University administrators need to be on board to support and nurture the program. In short, for summary, there are some examples of remediation programs and they can be used to modify and cater to our institution. An article by Warburton, Gorin, and Dine reviewed a program developed by the University of Pennsylvania. We will briefly review the process. They recommended 4 components of the remediation process. Step 1, the assessment of the learner in need. It is a formal checklist that allows the faculty and the preceptors to select the areas that the learner is having challenges with. It's a form that's completed and submitted to a board that is responsible for evaluating and helping the student with remediation. Step 2, the evaluator is interviewed, and sometimes there are direct observations, and these are collected with the evaluator watching and observing the student and interactions. Step 3, a 60-minute interview is done with the learner, and this is done to obtain their personal reasons for the problem and to screen for depression, burnout, substance abuse, difficulties at home, with housing, with food, whatever the reason may be. Step 4, after information is collected and reviewed, a diagnosis is made and a plan is formulated. The plan is presented to the learner and remediation begins. There is regular feedback and observation during the remediation period. This means that as the remediation is taking place after a week or two, not an exact time, but it's often that the remediation person and the learner meet, they discuss what's going on, they review it, they give feedback, and this is going on during the whole process of remediation. Remediation plan example. So the University of Pennsylvania has a plan that they created, and they came up with 5 categories of clinical deficiencies. The first category is in medical knowledge. They have a category for clinical reasoning, deficiencies in organization and efficiency, in professionalism, and in interpersonal or communication skills. They determined that a remediation of any learner is time-consuming and very expensive. The educational institution must be invested in this process, but there are many benefits to having this program. The benefits of successful remediation are that students complete their medical program. The university is able to attract more students. The university is not at risk of losing accreditation. There is improved economic well-being of the students. There is improved psychological well-being of the students. And we end up with confident clinicians who are prepared to enter the workforce. Post-test. We did the pre-test. We just reviewed it really quickly now. Now I want to just review the post-test. So number 1 was true or false. The definition of medical remediation is the act of facilitating a correction for trainees who started out on the journey toward becoming a physician but have moved off course. This is true. The following are benefits of a remediation program. Mark all that apply. Benefits. Retention of students, that's a benefit. Students dropping out of the program, that doesn't happen usually when there are good remediation programs in place, so not B. Improved mental health and confidence, that's true for everybody, for the students, for the professors, for everybody involved. Educated and competent clinicians, definitely a benefit. The following are challenges of remediation programs. Mark all that apply. Additional expense, it is expensive. Additional training and new staff, absolutely. Not most, but many educators may not have advanced degrees with psychology, with interviewing, with doing these types of evaluations and assessments, and that costs money to get them trained to do that, and then the amount of time needed per student for remediation is almost a full-time job as well. So they're going to have new staff to do that. So definitely a challenge. Large number of students need remediation. That's not true. There usually are not a large number of students who need remediation. It's usually a percentage, I want to say less than 5%. Limited number of dedicated staff. That is a challenge. Many programs, because there isn't a standardized process in place, have created their own form of some type of remediation. That goes into number 4. True or false? There are many different frameworks for remediation programs to select from. That is false. There are not a lot of frameworks. There are a few programs out there that have frameworks in place, but there is nothing standardized to use as a foundation to cater to your institution. Number 5, true or false? Most PA programs have a remediation program included in their PA education curriculum. I would make that question false because it's not included in the curriculum. They have remediation programs, but they're usually separate from the actual curriculum. They're proposing that it should be part of the curriculum. So the students feel like it's part of what they're learning. A good example of this is your athlete. So if you have an athlete that has trained for years, is a professional, gets paid money to do his job as an athlete, and he gets injured, he's not going to be kicked out of the team. He's going to get rehab so that he can get back to his level of performance. So it's not, that's part of their curriculum as an athlete, and that's what the goal is with a true curriculum program within the system. True or false? There are 5 areas of clinical deficiencies that are used for remediation at the University of Pennsylvania. That's true. We reviewed what those 5 were. True or false? A successful remediation program will not be able to identify early signs of failing student and address it to help them succeed. That is false. A successful remediation program will identify any students that are having difficulty early on, and they will be able to address it immediately. I hope this was informative, and I hope it helps some of us think about how we can help our students to succeed. If there's any questions, please let me know. Thank you for your time, and have a great day.